You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me in the Dental Zone. If you'd like to know more, you can always jump on over to holisticdentistry.au. Today, I am going to be talking about holistic dentistry and why people choose an holistic dentist. In recent years, I've seen a dramatic increase in the number of practices saying that they're offering holistic dentistry, and that's largely been driven by you, the patients and the consumers. Now, one of the things that I find a little bit concerning is that there is a big difference between claiming that you're holistic and actually being holistic. There's much more to it than, labelling something. And I think it's very important to understand that a holistic dentist should be taking care of you as a whole person. They should be looking at your health and well-being, and they should be really avoiding materials like dental amalgam that contains mercury and not recommending fluoride or fluoridated products, because it's important that we're not adding toxins into your body. The next step is that holistic dentist needs to be mercury safe as well and not just mercury free. And that means that they're going to employ smart amalgam removal protocols. They're going to use safety equipment to protect you from any mercury exposure, and also that they're looking after themselves and their team and the environment as well. Yes, I understand there are a lot of people who are scared of the dentist, and I'm not so calm. But I understand when I'm on the receiving end that it does need to be done. And I think the key there is to find a dentist who's going to take some time with you and explore why you're fearful and how they can support you, and just take things step by step. So there's been this big increase in number of practices that are claiming that they're holistic. Now, in the past, I think patients or clients were happy to just have their teeth fixed, but attitudes towards dentistry are changing. And thanks to the internet and things like video, people are much more informed about all aspects of dentistry. And they're learning that what's going on in their mouth, their oral health, is impacting on other areas of their life and well-being. So more and more people are turning to their dentist to get information from everything about what's the right diet, can they help with sleep problems, sleep disordered breathing, and what options there are for the environmental impacts of the materials. So, people are being more knowledgeable and they're asking more questions. And as a profession, dentistry needs to move to keep with the times. I tend to see patients from all different backgrounds and walks of life. I'm always surprised at the variance in age, demographic, and professional or working background as well. The common thread, though, is that people want to take better care of themselves. They want to have a clean, healthy body. They want to live well. They want to live a long life. And they feel that as a dentist, if we work holistically, we can support them to do this. So these patients are asking better questions. They're much more informed about heading along a holistic path in their healthcare. I've learned a lot from them, from their own studies and research and things that have gone on in their life. Now, this type of mindset, this type of person who wants to care about themselves and their body, they're creating the demand for holistic dentistry. They're the ones driving it. Okay, so you might not have heard about what holistic dentistry is. It might be something new to you. So if you're wondering what that is, what is a holistic dentist and what's that approach? Well, traditional dentistry focus on teeth and gums and fixing problems after they happen, whereas a holistic dentist, our approach is much more on you, the person, the whole body wellness, and how that's impacting on the teeth and gums, and also how the health of your mouth is affecting the rest of your body. So yes, when you come to see me, if you've got any dental issues like decay, infections, gum disease, misaligned bite, breathing disorders, grinding, those sort of things, my job is to correct that for you so that we can deal with the issues, prevent them from spreading and getting worse, and get your mouth healthy again. But I also understand that by having your mouth healthy, I'm helping your body and you be healthy. For example, if someone's got gum disease, they tend to have raised markers of inflammation, so something that's called C-reactive protein or CRP, and that's one of the key predictors for heart disease and heart attacks. Now, that will also mean that they've got increased cholesterol. By treating severe gum disease, we're treating inflammation in the mouth, we're stopping inflammation spreading to the body, and we can lower those markers of inflammation and reduce people's risk for heart disease and stroke, cancers and diabetes. So there's a big avenue for us to help you and support your health. But if all we're doing is working on your mouth and we're not educating you on how to take better care, then those things aren't going to work, because you're just going to find yourself back in the same set of circumstances. So that's where we've got a bit of a philosophical difference, so that we're treating dental disease in regards to your health and well-being. So I run Evolve Dental Healing. We're in Brisbane. We've been a holistic dental practice since 2005. And yes, we focus on the physical effects of your dental health on the body and vice versa. But, you know, probably speaks to you and all you nervous people out there, is that we understand that for many people, having dental treatment is going to bring up a lot of emotional issues. It's going to make you feel vulnerable. It's a big trust thing. It's also going to bring up some stress and anxiety. We have to approach you as a whole human being and include you in your treatment and help you through each stage so that you're empowered, you feel more comfortable and in control while you're having your dentistry. So we're going to use traditional mainstream dentistry. I still have to drill teeth, I still have to place fillings, but I'm very careful about the materials that I use, and also, as I said, about educating you on then how to prevent that from happening. You know, our goal is, you know, to help you fill your years and not end up having to fill your teeth all the time. So we're going to focus on diet, nutrition, the use of supplements where that's appropriate, techniques to help you involve your emotional and your energetic well-being. It's a complete person approach. So these days, what I'm seeing more and more of is that because illness and disease is on the increase, we're seeing a lot of ill health conditions in people of younger and younger ages, and we're seeing people with multiple health conditions. I mean, it used to be that someone would come in and they've had one thing, so maybe they've had heart disease, but what we see now is they've got 5, 6, 7, 8, 9, 10 things, or they're presenting with conditions that mainstream medicine doesn't really know why they've got them, how to treat them or how to manage them, and the patients are taking it into their own hands to be their own physician, for want of a better way of things. They're trying to unearth all the answers to their problems and rule out every single aspect. So a lot of people have come to me because they're not well. They want us to get their mouth healthy, remove their amalgam mercury fillings, educate them on how they can better care for their mouth, and see if that's going to be part of their puzzle on the way back to wellness. So these people are striving to be as healthy as they can, whether they're already unwell or whether, you know, they're fit and healthy. And we want to provide services to our patients that they desire and that they request, and that means doing research on their behalf a lot of the time. So while we're actively treating things like gum disease, we're also going to treat things like sleep apnea and snoring, misaligned bite, infections, and we can help with cross-referral to other practitioners to support the general health and people's mental and physical and emotional well-being. I think, you know, you've got to start now being able to look at the complete package. Now, I first discovered the importance of holistic dentistry in 2000 when I moved to Australia and was working for Amalgam 3 practice. As regards to oil pulling, it's no more beneficial than a good alcohol-free, fluoride-free mouthwash. My actual opinion is if you overdo it, you know, if you're doing it for the amount of time they say, you're at risk of actually destroying the good bacteria that are healthy and that protect your mouth. And I've seen a lot of patients who swear that they're religious with their oil pulling, yet their gum disease is in a terrible, terrible state. And I think it's because they're disturbing the balance of bacteria, that oral microbiome, which is like, when your gut's off, it's part of the same system. Vitamins and supplements, it depends which aspect you're coming from, but generally you want to be having lots of minerals, so calcium, magnesium, potassium. You want vitamins A, C, E, K2, and vitamin D to help support your gum health and the strength of your teeth as well. But if you're getting a diet that's optimal in nutrition, so you're eating real food, lots of fresh vegetables, a little bit of fruit, good quality proteins, plenty of water, then most of the time you're going to be getting what you need from that. Oh, another great supplement is krill oil as well. That's very beneficial. But if you're thinking more around detox, well, we'll have a conversation about that. So I was saying I started working at a holistic practice in 2000, and it surprised me how few people really understood that your mouth, is actually part of your body, and that there's a link. If your mouth's not healthy, your body's not healthy. If your body's not healthy, your mouth's not healthy. But it's like we've got this disconnect that this here is just a hole, but it's actually part of you. It's actually inside you. So I was really shocked how little people understood about their own body, yet alone what was going on with their mouth and gums. You can see inside your mouth, but so few people actually have a look. And also people were very confused around their diet and their lifestyle and how that impacts on their health as well. So I focus on your oral health, and I support you with issues like things like bad breath, dry mouth, chronic TMJ, clenching and grinding problems. I'm going to offer some nutritional advice where it's within my scope. We can recommend supplements, and we can also liaise with naturopaths and integrated GPs to be able to support with that. We want to go beyond brush, floss, don't eat sugar. I think everybody knows that that's the key to good oral health, yet that's not doing enough. I'm still seeing people with aggressive dental disease, advanced gum problems, many, many issues that are going on in their mouth, and yet people will tell me I brush and floss and I don't eat sugar. So something's missing in the equation there. So people want to be healthy, they want to know what they can do, they want to prevent problems, especially when it comes to dental decay and gum disease. People don't like going to the dentist, they're fearful of it, they don't want to have treatment. So our role is to encourage preventive care and a preventive program whereby you come, we have regular examinations, we have regular gum therapy and treatments to make sure that no gum disease is actually happening, rather than waiting. A little bit like your car, take it for a service. Don't wait for it to break down and then wonder why it's going to cost you so much to fix it. So there's two factors. People don't like coming. Look, it's uncomfortable, it's unpleasant, it can be invasive, you're very vulnerable, and we have to respect that. Also, it's expensive, and I'm sorry, but that is a fact of life. It is very, very costly to run a dental practice, our equipment, our materials. It costs a lot of money, and I'm not just saying that to make excuses, it's the truth. You go to the GP, basically, and sorry any doctors who are watching, I don't mean to be derogatory, but basically your GP's got a stethoscope, one of those things to test your blood pressure, and a prescription pad. Doesn't cost a lot to set up, whereas our equipment is very costly to purchase and very costly to run, and that unfortunately makes dentistry expensive. So if we can help you overcome your fear by building a relationship, one that you trust and that you're open with, and I can also help you limit your expense by preventing you from having dental disease and preventing you from needing expensive treatment. To me, that is a win-win. And 3, if we can help you to be fit and healthy and well, you're going to live a great, long, happy life, but you're also going to have less dental disease. So it's a trifecta there where we've got to look at every aspect. Otherwise, it's just going to be this common thing where dentistry is reactive. You break a tooth, you come in and get it fixed. You get toothache, you come in and you get it fixed. But we're always playing behind rather than being on the front foot and ahead and actually saying to you, these are the things I can see, this is what we need to do to correct that and stop it getting worse. I'm supposed to be drilling teeth right now, but I've got a little bit of a gap, so I just thought I'd pop in and say hello. keeps me out of mischief, and the team think I'm working and don't give me admin to do, but don't tell them. So where was I? Yes, I was talking about, we've got to go bigger picture. Yes, brush, floss, don't eat sugar. Let's look at nutrition, diet, sleep, stress, hydration, emotional well-being, toxins. Let's look at lifestyle, and let's be preventative and proactive. As a holistic dentist, where we can, we want to try and spend more time with you. We want to get to know as much about you as possible. We want to examine you very thoroughly. We want to discuss your health. We want to get a really good picture of your general health, your lifestyle, any implications or stresses or health concerns. I want to get a really in-depth insight into your oral health. So that means I spend a lot of time looking around inside the mouth. I look at your bite, your jaw joint function, how you breathe, how you talk, the condition of your gum health, the condition of your teeth. That means that we take a lot of x-rays and we take a lot of photographs. Now, you might think that taking a lot of x-rays doesn't sit well with being holistic. Well, it is because we can't leave any stone unturned. I can't see underneath your fillings. I can't see in between your teeth. I can't see your jawbone. I can't see around the end of the roots. Without the right information, we could be leaving things untreated, and we could be heading to big problems that could have been avoided. We take digital x-rays, so we get great pictures, and that means, we're reducing radiation exposure by 80 to 90%, so we can get those images in the confidence that we're doing the right thing. So once we've got all that information and we've got the pieces of the puzzle together, we want to work out what the priorities are. What do we need to do? What are we going to help you with? What are you doing for yourselves? And we can give you a full understanding of everything that's going on. Now, I'm very honest when I do a consultation, and sometimes that upsets people because they weren't expecting to hear everything that we've seen. But it's my job to tell you exactly what's going on and then to help you decide if you want to get that treated or not. It's your responsibility, the condition that your mouth's in already, and it's then your responsibility how you go forward with that. My job is to give you the information, give you the advice, share my knowledge and expertise, and help you come up with a plan to treat it going forward. The more you can understand what's going on inside your body and in your mouth, the more empowered you will be to take action. So a common area to all holistic dentists is our desire to eliminate mercury amalgam. It's illegal for us to dispose of this in the garbage, to flush it down the toilet or wash it down the sink, for example. It has to be disposed of by law as toxic waste material. Yet there are still dental professionals who just can't quite put two and two together and make the connection that putting mercury in a human being's body is not a good thing for health. Yes, we can go into all but once you've mixed it in with the silver and the other metals, it's all bound. No, it leaks. It leaks from the moment it's placed in your tooth to beyond your death. It leaks when it gets hot, when there's acidity, when there's friction, clenching, grinding, chewing, brushing your teeth. That mercury leaks from the filling and it is going into the human being's body. Then we can have the argument of, it's a tiny, tiny amount. There is no safe exposure limit to mercury. That means even a small amount is doing harm to the body. So why are we still using it? We've got new modern materials. It's like saying, carrier pigeon works. Yes, it does, but we've got email, we've got SMS. We've got the internet. We don't need carrier pigeon. Let's move on. Let's get with it. Let's get modern and let's get healthy. So, mercury fillings, that's pretty much where us holistic dentists are all going to be in agreement that we should not be using mercury and we shouldn't be putting metal in people's teeth where we can. So, another thing is we don't like using fluoride. It's up to you whether you use it or not. It's not my job to tell you what you do and don't do, but we don't use it in our practice. We don't do concentrated fluoride treatments. We don't even have it in the water that's coming through the drill or in the cups that you have a rinse with. So As a holistic dentist, there's only so much I can help you with. I mean, I'm there to treat your mouth. I can give you advice. So we have an extended list of contacts of other professionals who will cover aspects of different health problems and healthcare with you. So I have a lot of involvement, not with just mainstream doctors and other dentists, but physios, people who do body work, nutritionists, naturopaths, and so on and so on. So if there's something that you're looking for as part of your care, we can usually help you with that. So you might be thinking that we're alternative, but we're not. We're actually complementary. So we're complementary to medicine and we're complementary to dentistry. We can't wave a magic wand and fix your decay without removing it from your tooth and placing a filling. If you've got an infected or dead tooth, then I don't have a magic solution that will prevent you from having a root canal or losing your tooth. Sadly so, that is the truth. So we have to work out what's right for you. So I want to use the latest technology, I want to use the best materials, and I want to create great patient outcomes. So as I was talking about before, I use digital x-rays, that lowers the levels of radiation, and that's really been enthusiastically embraced by holistic dentists. We use things like amalgam separators and retrieval units, and that ensures that we've got no mercury going out into the water supply when we're removing those dental fillings. We'll use special filtration units like an IQ Air, and that's going to capture the mercury that's given off, any particles there as well. So it's not going to be inhaled by us and it's not going to be inhaled by you. We use rubber dam, we use special clean-up tips, which are like little suction cups that go around the teeth if we can't get the dam on. Some patients are very claustrophobic and they find it quite intimidating to have that over their mouth, and we don't want them having a panic attack and a bad experience. So we're always looking at ways that we can support that. I'm a member of the International Academy of Oral Medicine and Toxicology, so I've always been kept up to date with the latest protocols and guidelines and research. So the fact is that these technologies complement what we do. They help us do our dentistry, they help us protect you. We're going to recommend complementary therapies, hands-on healing techniques, and, there's holistic dentists who will do, some of those modalities themselves depending on what works for their practice. We're going to help you. We'll offer a range of supplements, antioxidants, natural oral health products that are fluoride-free, and we're going to help you with the after effects of dental treatment, particularly if you're having your amalgam fillings removed. So we're looking at all bases. We want to support you to be healthy and well. So for me, the core of holistic dentistry is about our relationships with you, the patient, and using whatever means that are available to us to get you the best possible outcomes. We need a clear vision of what causes ill health, and we want to encourage people to be well, and we want you to be, in the best possible shape for your circumstances. And that's why I've chosen to work as a holistic dentist, because I want to do more for people. Just drilling and filling and cleaning away tartar, whilst it has its place, for me it wasn't giving me job satisfaction, and I knew that there was more that we could be doing for people. So it's been working for us to be a holistic practice. If we stick with the old way of doing things, then we're going to be faced with some major challenges in dentistry because we're getting caught behind the times. People are wanting something different. Yes, they want nice looking smiles and they want to to look fresh and bright and youthful, but they also want that mouth to be healthy. So we're at a bit of a crossroads in dentistry at the moment where I think we're facing a bit of a difficult time. There's a lot of competition, people are more savvy, and if we move with that, it could actually be a great opportunity, and it could be a golden time to be a dentist and to be making a difference in people's lives. And that's why I do what I do, and that's why I've chosen to be a holistic dentist. And I think that's why more people are choosing holistic dentistry too. I'm Dr. Rachel Hall. I have a few new patient openings that we hold open each week. And if you'd like the holistic approach to your dental care, then please give us a call on 07 37 20 1811, and I'd be really happy to see you, to get to know you, to understand what's going on in your mouth, understand your challenges and your health goals, and work together to achieve that. So it's 073720 1811, or you can email if you don't like talking on the phone. info@holisticdentistry.au. I'm Dr. Rachel Hall. This is the Dental Zone podcast. Thank you so much for listening. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.